Hello there, and thank you for joining us on TVC Midday News. We kick off in Abuja, where an executive bill to establish the National Social Investment Program Agency for the management and implementation of the National Social Investment Programs has scaled second reading at the Nigerian Senate. The bill was read for the second time after a debate led by the Senate leader, Senator Ibrahim Gobir, during plenary. The bill seeks to provide a statutory and institutional framework for the implementation of the National Social Investment Program. Correspondent Tijesu Adeoye has more.
Plans to institutionalize the National Social Investment Program, initiated by the Buhari administration in 2016, is in top gear as the Nigerian Senate begins the consideration of the establishment bill. The Senate leader, in his lead debate, briefed lawmakers on the general principles of the bill and how it will impact the lives of citizens.
Since the inception of NSIP in 2016 to date, the following key achievements have been recorded. 1 million youths have been empowered through the Empower program, and the additional 500,000 are undergoing various training under the program as provided by Mr. President and Commander-in-Chief.
The bill elicited a robust debate from lawmakers who all acknowledged the significance of this piece of legislation. But some of them picked holes in the implementation process of the safety net programs. They now hope that the new bill will ensure it is more transparent, efficient, and effective.
What we had was that people got the handouts, it didn't matter to them, they were just looking forward to more, and there was no arrangement whereby people could be monitored, and whatever was given to them could also be monitored.
Accusations have been said about the implementation of this program. Now, we are pleased that it has come as an executive bill for us to establish a system, through which, a proper implementation, can take place.
I believe that this is an effort by the administration to ensure that there is a legacy for this program, and also a legacy that can make the program more transparent, more efficient, and more effective.
The bill scaled second reading and has been referred to the Senate Committee on Special Duties for further legislative action, and it is expected to return to the chamber with its report in 2 weeks. Tijesu Adeoye, TVC News, Abuja.
Experts at the maiden edition of the Medical Education Summit are seeking solutions towards improving the number and competence of the medical education and practice workforce. This, they believe, will help retain the workforce in the health system and stop the recent brain drain through advancing medical competency by graduating medical doctors and increasing their numbers. Health correspondent Kemi Balogun has more.
The World Health Organization recommends that the doctor-patient ratio should be at 1 doctor to 600 patients. In Nigeria, this has fallen short of this recommendation, with 1 doctor available to treat about 30,000 patients in some southern states and about 45,000 patients to 1 doctor in the north. The decline has continued in recent times due to brain drain, with many skilled physicians leaving the shores of the country, further depleting the workforce. This maiden edition of the Medical Education Summit is seeking ways to stop brain drain. Speakers want all hands on deck to stop the exodus of the health workforce through improving the number and competence of the medical education and practice workforce, retaining them in the system, and attracting the already migrated workforce.
Simple thought leaders in our profession to share their ideas to stimulate broader and deeper thoughts and actions to salvage our profession from the existential threats posed by unrelenting exodus of not just young doctors, but also their seasoned trainers.
Now, we also observe that faculty having additional clinical and scientific competence or pedagogical skills are felt to be essential or important by the vast majority.
Medicine is dynamic. we all agree, as of today, technology is fast taking over everything. And therefore, even at medical school, we must see how we can introduce some technologies in our teaching curriculum so that all this can easily be accepted.
Improving health outcomes through addressing worsening doctor-patient ratios will go a long way in boosting service delivery and manpower development to provide critical and essential medical services for citizens.
We've come a long way, but we still need to do more. Look at the data, the output, 948 from 948 to 2021 of 43,205. But you don't have those number of doctors now.
The theme of the summit, organized by the Medical and Dental Consultants Association of Nigeria, is advancing medical competency in graduating medical doctors and increasing the numbers. Kemi Balogun, TVC News, Abuja.
The federal government says progress has been made in efforts to provide access and a better life for persons living with disabilities in Nigeria. This since President Muhammadu Buhari gave his assent to the Discrimination Against Persons with Disabilities Prohibition Act. It says such persons now work in government establishments and have also been able to engage in economic activities as well as being self-reliant. Moyo Thomas has more.
The Ministry of Humanitarian Affairs, Disaster Management and Social Development is directly in charge of ensuring inclusion of persons with disability. It is marking the International Day of Persons with Disabilities in Abuja with a pledge to show more commitment to the welfare of persons with disabilities for national development.
Sub-themes chosen to reflect.
Umar Binder, who spoke on behalf of the minister, says this is also important for the realization of the 2030 Agenda for Sustainable Development.
This year's commemoration globally is being centered on the overarching theme of innovation and transformative solutions for inclusive development, in line with the theme of the 77th session of the United Nations General Assembly.
One of the provisions of the Discrimination Against Persons with Disabilities Prohibition Act is access, enabling infrastructure to enable persons with disabilities move around public buildings. This has not been complied with by many organizations and businesses. But the ministry says efforts are ongoing in this regard, while tasking state governments to also ensure the implementation of the provisions in the Act in their various domains. The Disabilities Commission also appreciates the efforts of the present administration and hopes the next administration will only build on the successes recorded.
Sincerely speaking, we also appreciate His Excellency President Muhammadu Buhari. We always say it everywhere. Since the amalgamation of Nigeria in 1914, we have never had a president like President Muhammadu Buhari. This is the only president for the disability community, and this is the only president we know.
Pushing the persons with disabilities to ensure that they are included, particularly in the economic activities, so that they are generating wealth, they are generating employment, is also ongoing. So the excitement of the government is the functionality of the Disability Commission.
With Nigeria deep into the election seasons, it is important every citizen understands that persons with disabilities also have a right to vote and be a part of the process. They should therefore be accorded their rights and respects. Moyo Thomas, TVC News, Abuja.
Stigma, discrimination, poverty, poor access to quality health care are some of the challenges people living with disabilities face in Nigeria. To celebrate persons or such persons here in Lagos, some NGOs are on grounds to educate them on their rights as well as enabling them with free medical care to improve their health. TVC News in Niolua, Popola has more.
About 1.3 billion people experience significant disability worldwide, making the living conditions and accessibility to healthcare more difficult. Michael is a person with disability, but more importantly, an athlete who has not allowed the healthcare system affect his passion. Truly, to every disability, there is an ability. He says the government needs to do more in ensuring there is total inclusion of persons with disabilities.
to healthcare of a person living with disability in Nigeria is not that accessible. In Lagos, some parts, yes, they put into consideration of person living with disability when it comes to their constructions of hospitals and all that. Generally in Nigeria, we are still lacking behind when it comes to access to healthcare for persons with disability.
To celebrate the International Day of Persons with Disabilities, advocates from various NGOs are sensitizing the disabled on their rights as well as giving them free medical treatment.
Nigeria has a community who are still fighting, who are still trying to ensure that we understand the policies that are even available. That is why it is important to even educate the community, the people, about even the policies that protect them.
One thing I always preach is openness. Let persons or medical personnel be very open to understand persons with disability. It's more or less like having a disability etiquette. How would they want to treat persons with disability?
How much budget are you budgeting for healthcare? We had an Abuja convention that says we should be 15%. We are still at 80% in Nigeria. And how are these budgets implemented? What is the focus of the implementation? Who are those monitoring the implementation? So sometimes you give 9% of budget to healthcare, but nobody's monitoring it, so we're not even sure if the budget is actually going to where they should go to.
As Nigeria races to achieve universal health coverage as part of the SDG goals by 2030, these advocates are calling on individuals, medical professionals, and government to help eradicate discrimination and inequality among persons with disabilities. TVC News, Lagos.
In Kaduna State, more than 28 adolescent girls will be beneficiaries of a scholarship grant by the World Bank. The aim of this initiative is to improve secondary school education opportunities for girls in targeted areas within the participating states. TVC News Loperasom has more.
Adolescent girls in Nigeria are faced with peculiar challenges which either excludes them from education or prevents them from completing secondary education. These challenges include early marriage, cost of schooling, and all forms of gender-based violence. As an intervention, the World Bank, under its Adolescent Girl Initiative for Learning and Empowerment, AGILE, is giving scholarship grants to over 28,000 of such girls in Kaduna. The beneficiaries are selected from 16 out of the 23 local councils in the state, where these challenges are prevalent. At the flag-off of the distribution at Rimi College in Kaduna, the parents of the girls are given 10,000 and 15,000 naira each for the students of JSS1 and SS1.
We want our girls, adolescent girls, to be enrolled in JS1 and to be retained, to transit to SS1, that's senior secondary, and then complete. So Agile has given the opportunity for adolescent girls to get a scholarship in the form of conditional cash transfers of 10,000 and 15,000 each, and also just to encourage them.
The acting governor, who is a special guest, is delighted at this support and intervention.
Our desire is to see as many girls as possible complete school, secondary school, go on to higher institutions, and become managers of society.
The group is also distributing eco-friendly cooking stoves to the caregivers of the girls, which will serve as a better alternative to the use of firewood.
We'll give them this green clean stove. It's a sustainable energy home household device that will enable them cook faster, and it will save firewood. They don't have to go. We've also made these briquettes from locally made materials, around raw materials, and we also teach them on how to make these briquettes, this charcoal.
They hope that through these interventions, more educational opportunities will be created for girls. Lupe Asom, TVC News, Kaduna.
We talk about the economy now, as the Central Bank of Nigeria has set a maximum limit for withdrawals over the counter by individuals. This now stands at 100,000 naira maximum for individuals and 500,000 naira maximum for corporations, with effect from January the 9th, 2023. Now, this announcement was made on Tuesday in a letter signed by the Director of Banking Supervision at the Apex Bank, Haruna Mustafa. The letter, which was addressed to all banks and other financial institutions, also reveals that cash withdrawals above the stated limits will attract a processing fee of 5% for individuals and 10% for corporates. Recall that as part of efforts to ensure full compliance with the Naira redesign deadline, the Apex Bank had directed banks to accept cash deposits beyond the cashless policy threshold. That's what we'll be talking about now. We bring in an economist. Samson Shoyebi is the MD, Chief Executive Officer of Honey Treat Academy, and he joins us now from Southampton in the UK. Many thanks for joining us at this time, Mr. Shoyebi. What are your thoughts about this latest cashless policy drive of the federal government? Do you think it will work?
Okay. Basically, first and foremost, I believe this policy is a very laudable one. Nigerians should be excited that for once, the government is looking at putting up policies that actually impact the society positively. People should be excited that this policy is coming on because first and foremost, it's going to curb criminality. It's also going to save the cost of funding for printing of currencies, which societies of the world are trying to do away with. People are going into cashless economies. I think it's a very good one. Again, you also look at the fact that majority of the people who transact in their banks collect less than 150,000 on a daily basis. The lesser, just about 10% of that of our population are the ones who use this huge fund. So you are seeing about 90% of the population who transact in the banks having to pay for the cost of producing funds, cash, the currencies that we use in the country. So a good policy will look at what will benefit majority of the people. And I think I give it to our President Muhammadu Buhari, for taking this bold step to go through with this policy. It's actually a very good one. Yes.
We've seen already POS operators kicking against this latest announcement, saying they will embark on a protest, and another group of stakeholders who say here in Nigeria, cash is still king. And so it may be good on paper, but if you look at the informal sector, which largely drives Nigeria's GDP, cash still thrives. What do you make of this argument?
Okay, so there is a saying that if you want to track criminality, follow the money. Eventually, this cash system-based BDC operation that we do is not going to last. You can't even find it in the economy in another 10 years. So at some point in our society, it must stop. And people should appreciate the fact that at the point we used to have, we don't have some technology to do some activities. We do now. And so means before, we don't have cashless policy, we don't have ATMs. People go into banks to can't recash. But that doesn't happen anymore. People have to live up with that. So the policy will come with some gains. It will also come with some pains. The bigger picture is what we should be looking at. And I've had reports of people who were duped by people who operate POS machines. If you really, really want to track this, you want to make sure that you track criminality, you must go the cashless way. And that's what the government has done.
All right, let me quickly ask.
Some people are not going to be happy with it. It's fine. All policies will always affect some people negatively. But what we should focus on is how will the government manage these people's interests so that those people who work in this sector will not be left with no job. What else can they be doing?
All right.
You know, so
also
that's what the focus should be. But at some point,
right. I also want to ask you what we do now about the inherent challenges in the system. Some have said fraudulent transactions might spike at this time. even failed transactions also might spike, as well as the technological challenges that we still have in making transactions at the moment. How do we curtail these concerns?
I'm not sure I follow that question. I'm struggling to hear you.
How do we curb the challenges of failed transactions, fraudulent transactions, and of course the technological challenges that some have said could be working against, the advancement of these cashless policies of the government?
Yes, at any point in time, there will always be fraudulent activities, either digital or physical. But then when you look at the challenges that physical transactions actually pose to the society, is far more than digital. Provided the government is able to put in checks and restrictions in place to ensure that fraudulent personalities do not take advantage of the digital economy. But at some point in our society, we will definitely go digital. I'll cite examples. For example, Belgium, they are doing about 93% of their transactions digitally. Even Canada, they are doing 90% of transactions digital. The UK at the moment, they are doing 89%. So if we are looking at advancing our economy into the 21st century economy, we will go digital. At that point, we create more digital economy jobs and let go of all the regular jobs that people are talking about now and advance to the digital economy that we were talking about, because this is actually part of the digitalization of the Nigerian economy. This is one of the process of achieving that. If you also check, prior to now, they've just done the change of the currency, which is also supposed to be a precursor to what we are having now.
Right.
And again, we are entering the election early next year. This should be a very good one.
All right,
for the
Samson
country.
Shoyebi.
Hopefully, people won't have to do cash payments during elections.
All right, thanks a lot, Samson Shoyebi, an economist, for your contributions on TVC News this hour.
Thank you for having me.